Welcome to R.A.T.S, Racing Against Time for Students in Pathology. The topic for the day is viral hepatitis and its importance is given in the enclosure. As far as I am concerned, I would like to limit myself to the pathological changes in viral hepatitis. The rest will be covered in your microbiology and other subjects as mentioned in the enclosure. A brief summary of viral hepatitis. We have got 5 different types, and nowadays they say more are being added to it. Hepatitis A virus and the E virus are waterborne infections or belong to the fecal-oral route of infection. And only hepatitis B is DNA. All the others are RNA viruses. This is a mode of infection, and I would like you people to remember this particular morphology alone. The hepatitis B virus is double-shelled. It measures about 22 nanomicrons. There are two kinds of particles, the small and the large. The larger particles measure about 42 nanomicrons. They can be tubular or spherical. And an icosahedral component is also seen in hepatitis A. This particular particle here is named the Dane particle, and it was found in an Australian aborigine, and hence it is also called an Australian antigen. The rest of the morphology you people can just go through. So viral hepatitis, when we mention, the common things that we should remember will be hepatitis A virus and hepatitis B virus. These are the dimensions over here, and as I mentioned earlier, there can be small particles as well as the large particles. And these are the routes of infection. The hepatitis D virus, in addition, can have a superadded route of infection, or it can be a co-infectant. This is an electron microscopic picture displaying the tubular structures that were found in an infected patient. And also, there are small spherical nodules. So each of these measure about 22 nanomicrons, whereas the larger one will be about 42. So these are called the Dane particles. This can be asked as an MCQ. And there are some general features which we should remember in viral hepatitis. The incubation period varies from strain to strain. The A virus has got an incubation period of 15 to 45 days, whereas the B virus 30 to 180 days. And there are some stages called the pre-icteric, icteric, and the post-icteric, or the pre-jaundice, jaundice, and the post-jaundice phases. And zone 3 is commonly affected. Zone 3 of the hepatic lobule. The common lesions that we can see will be what is called as ballooning degeneration. All these will be explained. A councilman body, local necrosis, bridging necrosis. These terms will be repeatedly arrived at, and I would like you people to kindly follow. Look at this one. I find that there are some hepatocytes which are getting degenerated, and also I am finding a small fragment within. This is probably an inclusion, a councilman body, etc. This can be seen. The classical example for a councilman body is the yellow fever, but it is also very commonly seen in viral hepatitis. Another thing that we should remember will be the hyaline inclusions. These hyaline inclusions can be seen in viral hepatitis, or they can be seen as Mallory's hyaline in alcoholic liver disease. They can be seen in Wilson's disease, as well as in hepatocellular carcinoma. The classical hallmarks of viral hepatitis will be a periportal and a portal inflammation. Please remember this one, periportal and portal inflammation. Then there can be a Kupffer cell hyperplasia. Cholestasis, stasis of bile. In fact, this has been described as bile lakes, or there can be extensive areas of patches of bile. Regeneration. Normally when there is a destruction, there is a regeneration, and this will lead to somewhat a disarray in the architecture. Disarray means a disarrangement. If at all there is one slide that I would like you people to remember, it will be this. Taken from Robbins. This is a picture of an acute hepatitis. See, this is just one segment that has been shown. There is a portal triad at every alternate angle, and there is a central vein. And these are the cords of hepatocytes. Look at the changes over here. You find that there is a ballooning of the hepatocytes. They get swollen. And there can be individual cell death, which is called as apoptosis. And look at this particular place. There is a lake of bile, cholestasis. So these are classical features. And whenever there is an individual cell death, there is later on macrophage aggregates which try to remove them. Apoptosis is classical. So remember these things. And around the portal triad, in that region, there will be a scant amount of lymphocytic infiltrate. These are the features of acute hepatitis. It is self-limiting, it will be going back to normal. Chronic hepatitis, on the contrary, you find that there is a dense inflammation. A dense inflammation in the sense you find lots of these lymphocytes around the portal triad. And here I find there can be some amount of accumulation that can be seen within the hepatocytes, a fatty change, and that leads to again a kind of swelling of the hepatocytes. The cytoplasm has got a ground glass appearance. A ground glass cytoplasm, I will be showing you the picture of it. Aggregates of lymphocytes and macrophages. So these are the ones. The main difference will be the density of inflammation that can be seen, and there can be a fatty change, ground glass hepatocytes. These are the ground glass hepatocytes. What is a ground glass? A ground glass is something that will allow light to pass through. At the same time, you cannot see what is on the other side. It is not transparent. This kind of an appearance is described as a ground glass appearance, all the cells. A typical appearance of a hepatitis B. This again will be asked as an MCQ. Chronic hepatitis, on the contrary, is divided into two different stages. One is chronic active hepatitis, the other is called chronic persistent hepatitis. First, let us see chronic active hepatitis. Extensive inflammation will be there. There will be more of fibrosis when compared to persistent. There will be necrosis of the hepatocytes, and cirrhosis will be the early hallmark of chronic active hepatitis. Extensive inflammation, more fibrosis, more necrosis, early cirrhosis. So everything is positive. That way you can remember. Chronic persistent, on the contrary, you find that there is a limited periportal inflammation, milder fibrosis, focal necrosis, and there will be a very late cirrhosis. This again is a gross picture of a cirrhosis in a case of hepatitis. I find that there are multiple nodules. You find that there are many nodules which are small. See this one. They are all very small. Maybe the predominant one will be a micronodular cirrhosis. And the paler color is the parenchyma, whereas the dark lines, you find that they are surrounded by dark lines. Each of this pale nodule is surrounded by a dark line, and that is an area of fibrosis. Externally, you will be finding a hobnail pattern. Cirrhosis, I can appreciate even without touching it, I can see how firm it is in consistency. Secondly, the nodularity, it is involving the entire cut surface, not part of the liver. So this is a chronic active hepatitis. I find that there is a dense inflammation in the periportal region. There will be a limited destruction of the hepatic parenchyma. that will be there. Focal necrosis will be there, which is called as piecemeal necrosis. Chronic persistent hepatitis, again, there is a limitation. It is called a limiting plate. You find that necrosis does not go beyond that. In the portal region, there is again inflammation. There can be some amount of regenerating bile ducts which can be seen. Kupffer cell hyperplasia. Kupffer cells are seen along the sinusoids. There can be regenerative changes and bridging fibrosis. What does that mean? Okay. This is an early stage of a cirrhosis. In this one, I am finding that there is a portal triad. There is some amount of fibrous pus. All the blue lines, there is a Mason's trichrome stain that is showing a blue line of fibrous tissue. It is incomplete and it is trying to intrude into the parenchyma. There is also a degeneration. Look at this one. There is a kind of fatty kind of degeneration which can be seen in the hepatocytes. And the spurs of fibrous tissue are going into the parenchyma. Whereas this is a full-blown case of cirrhosis. The limiting membrane is disturbed and you find that there is a bridging fibrosis from the portal triad to another portal triad, or from the portal triad to the central vein. There is a central vein over here. So there is a bridging fibrosis. Broad bands of fibrous tissue can be seen. At the same time, the liver is one organ where there will be continuous regeneration. So it starts multiplying. The cells start, or rather the groups of cells start bulging outside, producing the classical hobnail pattern. There is a collapse of the reticulin framework, bridging fibrosis. Look at the bridge over here and over here. And there is a regeneration of the parenchyma, nodularity, and cirrhosis. Again, Mason's trichrome is the stain. Yet another type of hepatitis will be the fulminant hepatitis. Fulminant means it is almost fatal. It can be submassive or massive. Normally, the weight of the liver is about 1.25 to 1.5 kg. Here it is reduced and you find that the capsule is collapsed. The liver is lesser in weight, the capsule is wrinkled, there is a yellowish green discoloration because of bile. It can be because of viral hepatitis, or sometimes it can be caused by drugs or by hypoxia. Fulminant hepatitis can be asked as an MCQ, too much of a question for undergraduates, but we should mention all the different types. Acute hepatitis, chronic hepatitis, fulminant hepatitis. And these are all the various stages. You find that there can be subclinical, acute, healthy carrier can be there. Then there can be a persistent as well as a full-blown chronic hepatitis patient. And this will be the fate of it. Fulminant can lead to death, whereas some patients will go in for cirrhosis. Cirrhosis itself can lead to hepatocellular carcinoma, rarely in a case of viral hepatitis. Death is also possible in this. So this is a framework. I would like you people to kindly summarize this. And these are the various antigens. Ag is the antigen. You find that there is an envelope antigen and there is a surface antigen. And hepatitis virus DNA. These are there initially, and subsequently you find that there will be antibodies. Anti-HPC, that is a core antigen antibody. Similarly, you have got a total antibody for this. And there can also be an envelope antibody for the various antigens. So this is a window period after which you find that there is a peak of the antibody and then there is a decrease. So this is important as marker. If you people can just mention what are all the various antigens and antibodies, it would suffice. Gracias.